thing we found was a synergistic process that occurs. That as the young people grows stronger and gets ready for discharge, not only do they leave behind all the behaviors and things that brought them to us in the first place, but they leave behind a stronger team. And that's really important and something that Nick will touch on soon. So, what's the magic trick here? You guys see the circles are the same, right? But what changed? Think of it in terms of like external and internal locus of control, right? External locus of control, that's emergency services, things like that. Even in a way, that's our team. But over time, as the young people see that they can manage crisis, first with our support, and then more and more independently, they grow in self-understanding, self-trust, and self-reliance. And overall, what that builds is a healthier, independent life. And really, that's the why. That's the why I mentioned. That's why we do it in the community, is because I'm a diabetic, for example, right? My life and any life managing a diagnosis is not about avoiding crisis. It's about making sure that we can prepare for the crisis, go through the crisis successfully, and come out the other side, hopefully, feeling pretty good about ourselves, that we made it through, that we achieved something. How are we going to show this, right? Well, we could do it a bunch of different ways, but how Nick and I decided to do it is with 3 case studies. And what you'll see is these case studies do progress and encapsulate different areas of these young people's lives. This one is David. We're not going to read every note on this slide. You all have met people like David before. David has had his share of struggles, but please picture a warm spring day, a nice pool in an apartment, and a young person on a raft in that pool, because that's how David and I had our interview. That's why he says something like in that upper corner, I feel like I've made it. I'm living right now. This is a young person who went through all of our local hospitals, 2 years in an RTF, and was on our on-call constantly. But through these quotes, we can isolate what are the parts that are all these things that we've seen in terms of collaborative crisis learning. We have self-trust. That's down there in terms of, it's over on the right, in terms of learn to handle that stuff and you're on your way. It's the whole name of the program. That's self-trust. We also have self-reliance. It gives me a better shot at handling the situation than handcuffs or an ambulance. That's a young person who relies on himself now. And what we finally have is learning about himself. I know I'm impulsive, but I got to get ahead of that stuff. So that's David. And now Nick will introduce you to our 2 other young people.
All right. So our next young person that we're going to talk about is Sean. Very similar to David, had a series of struggles. The one major difference was that Sean wasn't able to work through those struggles on his own, and we had to involve the family. Mom was a big support in this family dynamic. There was also a younger brother involved, and mom was stuck. She didn't know what to do. There were a lot of escalating aggressive behaviors in the home. There was a history of verbally and physically assaulting mom. Mom was unsure if she needed to call the police or mobile crisis. There was just a lot of uncertainty on how to handle this young person's struggles and their crises and their emergencies and what were the difference between those different categories. So what our team had to do was gear our attention towards the support of mom. So what that looked like was a lot of one-on-one coaching, psychoeducation around like what psychosis is, how it manifests, what it looks like, best ways to cope with it. There were a lot of family sessions that needed to occur, resource sharing, on-call support that sometimes didn't just include the young person, Sean, but also included mom. And that's what Sean needed. At the time, he didn't have the skills to do this on his own. And bringing mom into the scenario helped him increase a lot of the areas that Keith mentioned earlier, that self-trust, that self-understanding, that self-reliance, because he now had a better understanding that mom in the household could help him out. And that was all through kind of one of our major takeaways today, and that's the value of collaborative crisis learning. It doesn't stop with just the young person. It includes any and all natural supports. And in this situation, it was Sean and his mom. All right. And the final case we're going to talk about is Julie. And kind of in a similar vein, Julie had a handful of challenges, a lot of complex trauma, a history of being in the system, not the best experiences, high degree of suicidality, loneliness, really a lack of natural supports. She was somebody who came into our program and utilized the on-call every day during work hours, after work hours. She was stuck and she lived in a CRR. So for those of you who aren't familiar with CRRs, they are community residential rehabilitation centers in the community that help support our young people in their living situation. And we had to turn our attention to collaborating very often with the CRR. So what did this look like? This was like system of care meetings with the CRR and any other providers involved in Julie's treatment. Again, going back to what we were working with Sean, psychoed, resource sharing, on-call support. So when Julie would utilize the on-call, we involved the CRR staff, whether that was a counselor on staff, whoever it was, we did it as a collaborative process because that was the steps we needed to ensure safety. And it helped Julie realize that like she wasn't in this alone. And as you can see towards the bottom of this slide, like things started to change. Like this young person's perspective of the world started to shift. She started to trust people more often. There was clinical progress being noted. There was more insight, and that resulted in less on calls. And that even resulted in more confidence, trust in the clinicians that we had on our team because we were doing the work, we saw the results, and Julie was just on her way with her recovery. And again, like that final point is collaborative crisis learning doesn't stop with just the family, just the young person. Include everybody, include the CRR, include the neighbor, include the friend. Whoever can help the situation should be involved if necessary. All right, so lastly, I'm gonna hit on the importance of viewing collaborative crisis learning through a supervisory lens. I'm sure many of us on the call are in a supervisory or managerial or leadership type role. And it's super important when building and maintaining these teams who are doing this work day in and day out, right? So we looked at this triangle a few times throughout this presentation. And it's very important that we understand the team, trust in the team, and get to the point where we can all rely on our team. And that starts with the factors that are listed to the right. Like it begins from the door at hiring, during that initial interview, during the training process, like being open about what this work looks like. We're not trying to hide anything. We're looking for mental health professionals who are eager, excited, and want to do this work. It's extremely challenging, and we want mental health professionals who are a good fit. It's important that we model for our teams. Using strengths-based language is something that is so important to myself, to our program, because we see this day in and day out, and it can be really easy for us to get down on ourselves, our program, when we see things not going our way. But maintaining a positive outlook and focusing on what's going well is something that is really important and that we take pride in. Having that flexibility. Our program has an on-call schedule and it's draining. It definitely is draining, but as a leader, like how can we get flexible and make this work for our team so that we can strengthen our team and have retention and continue improving in the work we do. And then the final factor is supervision, just continuing to reinforce all the important practices that we talked about today and continuing to prepare and communicate around future crises so that we are well equipped and ready to tackle them.
One of the other safety features we have is a doorbell at the Southampton office that can ring all of our phones. That just happened. That was not intentional. But going to leave you with one simple image, okay? Back to David in his pool. I asked him, I said, Dave, there's going to be about 100 people here, 100 providers. Actually, there's 144, what I heard. That means countless young people like you. What's your message for them? His message was, as long as you have a good team and you don't stop trying, anyone can make it. Look, I'm honored, and I love the idea that he considers me part of his good team. That's for him to decide. He's the biggest part of that. The message that I think we've carried forth that we just want to end with is very simply, it doesn't take great teams. It just takes good teams. And any team can be a good team as they go through this with their young people, with the confidence that they build. Any team can grow stronger and be a good team, one crisis at a time. So thank you guys for that time. Any questions or things like that, I'm sure we can handle at the end. And also, if you're like, hey, I have a young person with psychosis who really is, a lot for our team to handle, and these guys are just kind of talking about this stuff like it's not that big of a deal, give me a call.
Thank you, Nick and Keith. Appreciate that presentation and overview today, and always appreciate, the contribution you guys have for this. So thank you. We do have one poll, and then we will hand it back over to Nick and Erica. As we start planning for next year's training, we just wanted to get some feedback from this group. If you would prefer the next year's training to be virtual, in person, or either works. So just going to give it a couple seconds, and then Nick and Erica can go back over to you. All right, thank you all. Nick, Erica, take it away.
Great. So perfect piggyback off of Keith, right? I think, we're saying nearly identical things. We're saying them slightly differently. And I love that, right? So I think that's perfect. And we talked about pre-crisis, obviously the value of those crisis plans, knowing folks, right? Part of what Keith described is being there, being in that challenging part with their folks, right? Working through it, but they're also walking in not blind. They know the person, right? Or they're learning the person, right? And it's evolving, right? You have that as well, right? So again, if we abdicate that to third-party crisis entities, right? They don't know any of that. They got to stumble around and get to it, right? You've got a jumping off place. You've got a building place. You've got prior interactions. Build off it. Doesn't always work. What worked today might not necessarily work tomorrow, but it usually does, right? I mean, those engagement techniques usually do. So leverage that, right? Which then kind of goes into post-crisis planning. We survived. They survived. Regardless of what the outcome was, whether we community stabilized, whether we had to go inpatient, whatever we did, we got through it, right? But stuff's still got to happen. That kiddo's still ours, right? We're ongoing care, right? We're not one and done care. We're ongoing care. So what was the coordination with it, right? If we're going inpatient, are we planning reentry, right? Everybody says the right words. Reentry planning starts at intake, right? Are you truly doing that, right? Are we really engaged with that? Are we sharing information on the way? Are we planning discharge and reintegration? Hopefully, if we were able to community stabilize and we solve the challenge today, I mean, do you just wait 30 more days for your next scheduled appointment? I would hope not, right? We just had a crisis. So can we do a little quick outbound call or stop by or whatever? What's going on? Just a quick check-in. You still feeling okay? You can always call 988. We're here, whatever our hours are, whatever the case may be, right? Doing that very soon around the crisis is really key. And to the degree that 988 the National Lifeline, Suicide Lifeline, mandates basically follow-up calls if the folks are willing, right? And there's great research that shows just that caring gesture in and of itself makes a difference, right? So we solved the crisis. Hopefully we gave Jimmy back his iPad. We calmed the upset group home staff. Maybe we need to call and check on them as well, right? And then the next day, should we just do a quick check-in? What's going on, right? Sometimes we're like, oh, I don't want to open it all up again. I don't want to necessarily. That's probably not the case. And if you can hear it's still escalated, why not get in now before he's nearly losing his placement, right? So those things are in person. Do it periodic, do it regular. We can click it, but we want to be proactive. We solved the crisis. Let's not wait for the next crisis to go from it. And then when it's good to do so, if you don't mind advancing, please, when it's good to do so, then we want to make sure we kind of debrief that with ourselves, with the kiddo, with the family, with the key stakeholders in there. What worked? What didn't work? You know, all of a sudden my great Dr. Pepper solution for Mary didn't work. She's no longer a pepper. She likes root beer now. I don't know, right? But what did or didn't work, right? What did we learn from the incident? What do we want to document? What do we want to move forward? Were there new triggers? Did we stumble into a trigger we didn't know about? In retrospect, were there warning signs, right? I mean, I gave you, and we had to expedite it, right? But I gave you that quick little vignette about my buddy Michael, right? Who was there. I mean, he would call me 3, 4, 5, 7 times a day. Even to this day, I've been retired like 8 years. He'll still send me a text at Christmas and things of that nature, right? Checking in. But the first time or two, I didn't realize, the dirty pans or whatever. And then I started, he started to get there and we started talking about it. And like, wow, in retrospect, these were warning signs, right? And everybody's are individualized, right? So, but what could we have seen a little differently? Now, next time, if I see that again, I'm going to discuss it with you. Does that sound okay, right? How do we, incorporate that? All of that should go back into your crisis plan, right? They should evolve. They should grow as your kiddo grows and evolves, right? And hopefully they're becoming more resilient, but it should kind of follow along with that, right? And then basically, as you thought about scenarios, might having information help you in some of those scenarios, right? Again, I don't want to beat a dead horse here, but right, there's a lot of running to mobile team, right, for solutions. If you had more information about your kiddo, could that have helped you come up with a solution a little better, right? If you truly knew the coach was a great resource and had been willing to be engaged, and if you truly knew that we created a safety plan around using your iPad, and you had that memorialized, would that help you walking in right up front? Like, hey, what was going on? Did you try that? Many of you are familiar with wrap and things of that nature, right? Where you kind of keep it on the fridge, but did you do those things, right? And were they the right things? Or did we forget about doing those things, right? And where did we start with? So keeping it around is very, very powerful. I think we can go to the next slide. Also, especially since most of you work with kiddos, right? And we're talking about family system, right? We've got to realize that, the family's all part of this as well. So not only are we just worrying about our kiddo, but we got to worry about that broader circle, right? That family system. So how do we help the family celebrate the success, right? How are they? What do they need? What should we likely have the same conversation of sorts that we're having with the kiddo with the family? What would you see differently now, mom or dad or cousin or uncle or grandma? Like now in retrospect, are there other things that could have been useful? Are there better strategies that we could have done, right? All of that helps them prepare, because you go back to key slides a few ago, right? Which is right. We want them to be in control of their self-managing it and working through it. So part of that is their family supports and everything. We're still here, but if they don't need us as much, are we going to be hurt or are we going to feel proud of ourselves, right? If they're growing, how do we help the family come along with that? So I think we can kind of go next slide. We've been saying that all along. And then really supporting them, right? They have the most important job, right, in that child's life, right? That's just the reality. They're there. How do we, encourage them to be successful? How do we encourage them to take care of themselves? How do we encourage them to be emotionally present? And how do we kind of give them the support to be there, right? Because if they're in crisis, it's going to be very difficult for them to help their child or their loved one, right, get through crisis, right? So they've got to be in a position and be prepared. And so you want to make sure you're not doing this in a vacuum, right? And maybe that includes IEPs and the schools and other folks if it's appropriate to share and bring all them into it, right? So that we're all kind of on the same page. Group homes, right? I mean, just be honest, some group homes are different than other group homes, right? And so, are they aligned with us, right? Or are they doing things that are counterproductive sometimes? So I think we can go to our next slide. There are plenty of trainings and things you can also refer them to. Assist, I'm sure all of these are all evidence-based training, so I'm sure all of these are present in one way or the other in your community. Assist is phenomenal. It's a 2-day training, so not everybody will go there, but signs of suicide is another one. QPR can be very quick and easy. You can get out there to help folks feel better. Mental health first aid is wonderful, right? There's lots of places and trainings we can point our families and our support networks to go get further training so that they're better prepared. And then obviously letting them know, hey, you're still never alone, even if like Keith got on calls and everything else, right? But not everybody has necessarily that robust. So if I'm not available, hey, there's still the Bucks County line. There's still 988. We still have all that. We still want to know about it, right? But in the minute, don't feel you're left alone. There's still things there to help support you and get through it. And a sizable minority, and I know this because Impact is a 988 center, a sizable minority of the calls are third-party calls, right? They're not necessarily the individual in crisis, it's the third-party call. So I wouldn't be surprised if it's as high as 15, 20% of the calls are actually third-party calls. So it's a significant group that can reach out. They're not alone. One more slide, I think. So again, and I highlighted it earlier, some of this may be old hat. You guys, I think we went backwards, didn't we? Oh, no. Maybe we didn't, but I feel like we've talked about all of the access to means. I don't think we need to go, but we can remind them that they are part of reducing access to the means. If you remember that early slide that showed the stats, it was over-the-counter drugs and prescription drugs. It wasn't guns, it wasn't bazookas, it wasn't nunchucks. It was over-the-counter drugs is the number one, RX is number two. So we can remind family that what's in your house that seems relatively benign are the two leading causes of overdose attempts in your community, right? So help them be aware of how they can reduce access to means, the different county programs, and just kind of some common sense that we just don't necessarily think of intuitively. I think we can go to the next one. Sorry about that, Chasey. I'm messing you up a little with my tangentialness.
That's okay.
The other thing is, for some of you, this is old hat. For some of you, maybe the first time you saw a formulaic risk plan, right? Level plan. So crises will happen. Not everything will go beautiful. Some will be a little scary. We want to learn from that. We want to share. We want to debrief. So however, those of you who are in a supervisory level, be sure to support that. If you're going to encourage your teams to, get deeper into crisis incidents, you're also going to need to support them from an organizational level, right? Keith kind of described some of that himself, right? We need to do some of those things. We need to make sure our policies and our organization will help find ways to support them, debrief it, and or, if there was some vicarious trauma, then how do we want to address that, right? Because not everything goes perfectly, right? We know that. Usually it does, but not always. Next slide. And I feel like we've all kind of been very upfront about this. Use common sense, good judgment. You all have been in this field for a bit. You're all doing good work. You all know how to work with folks. So these are just extra tools to help you out. If something feels unsafe, then get yourself safe, right? Nobody here is encouraging you to take unneeded or unwarranted risks. That's far from where any of us are talking about. However, what you'll find is the more prepared you are, and the more prepared you are just by training, by emotion, by support, and by reviewing crisis plans and things of that nature, generally, the more secure you feel in that intervention, especially if you've done them for a bit, right? You get comfortable with it, right? It's not as hard to deal with somebody who's yelling at you if you've experienced it a little bit more, who's got an elevated tone, right? Who's animated. The first time it might be, right? But you get a little bit more used to it as you get through it. And so the more calm and prepared you are, the more we can model that and help folks get through there. Obviously, follow all your policies, procedures. Nothing here is changing anything that your agency does. Notify supervisors as appropriate. When it's appropriate to call police, when it's appropriate to go to higher levels of care or activate crisis, do those things. Just be mindful of why we're doing them, right? That's kind of our messaging. And I think with that, the last thing before we hand it over to Erica for the last few minutes is hopefully this kind of training and education, right, kind of helps you in your job, your daily job. It helps the family. It helps the kiddo. It's less hospitalization. We're increasing their community tenure. We're getting closer to the folks. Like when you listen to Keith and Nick's stories, right, you can feel they're a team. They're connected. And some of that is that bond that's hard to describe, but it's forged in fire, the fire of crisis, right? And it is. And it's a strange bond, but it's a powerful bond. And so to the degree it's safe for you to do it, I encourage you to take advantage of it. Don't let the Keith of the world only be the ones with those bonds, right? Or the Mobilties of the world. You want some of those bonds too with your folks. So with that, we're going to hand you off to Erica, who's just going to do a very quick whiteboard around some, potential next steps. Unless you wanted me to kick it off, Erica, you let me know.
No, I think we're good. We're going to use the whiteboard to talk a little bit about this in terms of now what? Like we've had this training, you've done this, but now what happens, right? So go ahead and can you bring up the whiteboard then, Leah? Okay, so the first question that I'm going to ask you is, how can you implement what you've learned or what you've heard today into your daily work? And just think about that and just kind of do the same thing. Look for that big T and then do your text boxes. Educating team members. Teaching skills you learn to the caregivers. Stay calm. Very good. A lot of education, a lot of skill building. Be open to using different interventions. I like that one. Collaboration. Paying attention to our own responses and our body language and using that to stay calm and collected. Try not to outsource the role. Okay, use those de-escalation techniques yourself. Very good to help keep the youth in home.
Did everybody see Monica's big smile on that one? I saw her jump up. She was standing on her chair.
Yeah, I like that. That's a big one. That takes up a big old box. Educating the crisis team members, refreshing skills. Very good for least restrictive, right? Very good. Excellent. Identifying warning signs. Not what you say, but how you say it. Very good. Okay. So very good. So we're going to go to the next whiteboard and you're going to ask yourself, so what barriers do you anticipate and how can we work through those? So what are the barriers to doing? Go ahead.
I think I just heard that I've got a Moravian convert over there. Did you hear that? All right. I got another one on my team. The only problem with this new whiteboard, Leah, is it's so easy. It doesn't seem to have all the headache that poor Kelly had to deal with.
This doesn't seem fair.
It doesn't seem fair.
It really does it by itself. I think Zoom has learned to move it so it doesn't as many. So it's good. We won't tell Kelly though. We'll tell her I had a hard time with it.
So new staff that might lack confidence on their reliance for new skills. Yeah, it's a good one. It's a good barrier, but fixable, right? Can help support and help them work through things. Lacking support from families. Families' desire to have their children removed from the home. for sure. School policies, I can't read that, but. Systemic or institutional barriers. Lack of confidence again for the staff. I like this one that has the barrier listed, but then it also has a solution. I like the solution focused idea, right? So team tiredness, constant interaction with maybe a specific client who has the repeated behavior, doesn't seem to be making progress, right? But if we could focus on our self-care, have that positive focus, identify tiny baby steps, right? What are the strengths there for the individual? I like that. That was strength-based. We identified the barrier and immediately gave a solution.
Yeah. That's very real, right? Especially on
Yeah.
long-term ongoing care, right? It's not, right? It's one of the reasons some folks are drawn to crisis. It's one and done. Hey, success, and you're done. You moved on, right? But right, it's a process.
Sure. Yeah. These are all good and they're all very real barriers, right? So in terms of, what are some things that we can do to try and overcome them, coming up with solutions. Those are all important things. We have to focus on those baby steps. In terms of staff that lack the confidence, we can support them in those, right? And give them opportunities. Sometimes they just need those opportunities to practice. I assure you, there's no shortage of them with all the families that we work with. So bringing them along and kind of, we do a lot of shadowing for our new staff and practicing techniques because it takes that. It takes to see somebody do it, to see how it works, and then to practice those skills for sure.
And maybe for those of you who are supervisors, and Keith kind of alluded to some of this too, once a month you do a quick scenario with them and a quick risk assessment. You talk through it as a team, and then, hey, when you're out doing it on the street, you're not alone. Call me. We'll talk through it, right? But at least call me with a plan, and then we'll decide. We'll smooth your plan out, right? But just throw your hands up, come with something, right? And then we'll work with it. How do you support your, growing the frontline staff who may not be as experienced? I love it.
Good.
And I love that we are 3 minutes ahead of schedule for whatever Leah and Monica need to end with.
Perfect. Thank you, Nick and Erica. Appreciate that. I'm not sure if there's any other comments or questions here at the end as we wrap up. I just put in the chat the survey link, which will have an evaluation and post-test, and you can get your certificate. All of the resources and presentations that were reviewed today will be sent out tomorrow along with that link as well for the survey to get your certificate tomorrow. And that's all I have. Monica, do you have anything else? Thank you, Nick and Erica. Thank you, Nick and Keith from CFF. Thank you, Lenape Valley, Jamie and Erin for their presentations this morning. We really appreciate everyone coming today and coming year after year. So
thank you all for putting up with us and our antics. And I hope you have a great weekend coming up. And for those of you that were on screen, thank you. It's lonely on this side of the camera, so it's nice when we can see your face. So thank you.
thanks, everyone. Have a good rest of your day.
Thank you.